Hi, my name is Sammy McGowan, and I am from the UMass Memorial Training Team. During this video, I will be walking you through the steps of having a successful video visit with your UMass Memorial provider using the myChart app. UMass Memorial Healthcare is now providing video visits with providers. You can now schedule these types of visits through calling your office or by calling 855-UMass-MD. Once your appointment is scheduled, if this is your first video visit, you will need to go through the instructions provided to you at the time of scheduling to ensure proper device setup. You can also find video tutorials or proper device setup by searching UMMHC Virtual Medicine in your web browser of choice. In this video, we will go over appointment check-in and launching your device to your video visit. UMass Memorial Healthcare will give you a call a few days prior to your scheduled appointment to guarantee that you have set up your device properly. Okay, let's get started. You have booked your appointment, downloaded the myChart application, and downloaded the Zoom application. The office staff has let you know that you should go into myChart and do your pre-check-in prior to the appointment. Navigate to your myChart app and log in. If this is the first time you are logging in, you will need to accept the terms and conditions of use. Find the calendar on the screen. If you have scheduled your appointment, it should have a number in red above the calendar. The number represents the total number of appointments that you have scheduled. Tap on the calendar. You should see your upcoming appointment and click Pre-Check-In. Your pre-check-in tasks will open. There is a progress bar at the top of the page to show you your progress through the tasks. The pre-tasks will include personal information, insurance and guarantor information, medications, allergies, health issues, and questionnaires if your provider has provided them. It will also ask you to sign documents. Some of the documents may be the Joint Notice of Information Practices and other consents. Let's go through the tasks. We will start by verifying our personal information. If you need to update this, you would click on the Edit and Update as needed. Once you have verified your personal information, click the information is correct and select Next. Next, you will be asked to verify your insurance. You will notice at the bottom of the screen that you can add a picture of your insurance card if it has changed. You can also remove a plan and update to a new plan. Once you have verified your insurance, click This information is correct and click Next. The next will be your review of medications. You may add new medications that you may have started since your last visit with the provider. I'm going to add a medication. You will want to add your start date. Next, you would want to make a comment. I'm going to type in high blood pressure and click Next. You will now see that you've added your medication. Click This information is correct and click Next. Allergies work the same way as medications. Review the allergies we have on file. If you need to add an allergy, click Add Allergy. Type in latex. Select hives. Put in a start date, add a comment, and click Accept. Once you have completed this, select Information is correct and click Next. Health issues is where you can let us know if something in your health has changed. To add an issue, select Add and search for an issue or type one in. Add the start date and add a comment and click Accept. Again, select the information is correct and click Next. If your provider has questionnaires for you to fill out, that will be the next section coming up. On the screen, you can see that the provider is asking us to fill out a survey based on what our home life is like. You can see that the message states, "Health starts in our homes, schools, and jobs. Let us know what we can aid with." I will select stress. I will select yes, that I would like to talk to my provider, and click continue. Click submit. Because this is the first appointment that we're having over televideo, we will need to go through our medical history, surgery history, and other questionnaires. Remember, it will only ask you these questions once, as this is our first time doing pre-check-in on myChart. Once you have completed all the questions, click submit. Lastly, you will be asked to electronically sign a few documents. Although you can choose to review later, we encourage you to do so at pre-check-in. When you review and sign, you will need to scroll to the bottom of the consent and e-sign it with your finger or stylus, and then check the green check box on the side. Click submit, and should get on the screen that you have successfully completed your pre-check-in. We have now completed pre-check-in. The day of your appointment has arrived, and you've just finished the call with a staff member from the office. During this call, the staff will have discussed the reason for your appointment, gone over your medical histories, medications, and allergies. Once the staff has completed this portion of the call, they will instruct you to log into your video visit through the myChart app. If you are not currently in the myChart app, open the application. Click on the calendar and select the visit you have scheduled for today. You can now see that the appointment at the top of the screen has a small video camera. Click on Begin Visit. You will now be launching the video visit through Zoom. Select Open. We are now waiting in the UMass Memorial waiting room for the provider. Once the provider has logged into the visit through Epic, you will be launched into your appointment. You will know that the provider has joined once you see yourself on the screen. Click Join with Video. And now you will be in the UMass Memorial waiting room until the provider admits you. Once the provider admits you, you will see yourself and the provider on the screen. You have now successfully connected to your video visit. Once your visit is completed, you will need to make sure that you leave the meeting. By doing this, you are ensuring that you have closed out the session on your phone. Later that day or the next day, the provider will complete the documentation for the visit to review the after-visit summary. If you would like to go back to the calendar in myChart on the main screen, you would need to find the past appointment and click View After-Visit Summary. This concludes the patient video visit. Please call your provider's office for any further questions or call 855 UMass MD.